All right. Hello, everyone, and thank you for joining us for this week's Facebook Live. We have a lot to cover as always, and I am joined by Dr. Loren Hamel from Spectrum Health Lakeland and Nicki Britten from the Berrien County Health Department. So as we always do, we'll start with a little update on the trends. Nicki, do you want to tell us overall what we're seeing here in Berrien County?
Yeah, thanks, Jessica. And thank you all for being here and continuing to just stick with us as we're continuing 13 months in to continue to track and figure out how we as a community can continue to respond. Right now, we are in the midst of a continued increase in the number of cases and the amount of transmission that's happening in our community. We are seeing right now about 48 new cases per day on average, and that has been fairly steadily increasing for about the last 3 weeks or so. Our percent positivity of tests in the county is around 10%. So back about a month ago, we were sitting around 5%, below 5%. Below 5 is a very comfortable place to be. 10%, not quite as so much. The situation is not unique here in Berrien County. The state of Michigan is really seeing an increase in cases more so than many other states in the country. And in the media, it's kind of been dubbed one of the newer hot spots in the country. So our rise in cases here in Berrien County hasn't been quite as dramatic as some other communities in Michigan, but we're definitely watching carefully that there are other communities that are seeing this increase pretty rapidly. We do know that a large proportion or larger proportion of our more recent cases compared to say last fall are amongst younger adults and even children under the age of 18. We have seen a lot more cases amongst school-age children, particularly middle school and high school. So we're watching that trend. It's a little bit difficult to compare age trends and breakdowns right now compared to where we were in the fall, however, though, because the vaccine definitely plays a difference and it makes a difference in how this all plays out. So it's possible what we're really seeing is the absence of hundreds and hundreds and hundreds of cases amongst older adults that are now very well protected. As they're getting the vaccine, we're seeing those percentages increase. There's another factor with the variant strains. There have been close to 20. We've had 12 confirmed cases of the B117 variant. That's also known as the UK variant. And then there have been some other cases associated with those confirmed cases that are considered suspect. So we do know that this variant is more contagious. It's more likely to spread between people. There is not overwhelming evidence that it necessarily causes more severe illness or is more likely to lead to hospitalization or death. But with being more infectious, it means more people are likely to become infected. And as more people are infected, we do see more hospitalizations and deaths. So it's possible that the variants are playing a bit of a role. We do know that once variants are present in a community, it does fairly quickly become the predominant strain, not the only, but it becomes more common. So there's a lot of factors here that we're continuing to watch. And it's hard to make some comparisons as to where we've been because the vaccine definitely changes the landscape. It changes the susceptibility of our population. And there's more we're just continuing to learn as we watch trends and watch in other communities.
Thank you. And as you mentioned, we're also starting to see a rise in hospitalizations. Dr. Hamel, can you speak to what we're seeing at Lakeland?
Oh, certainly I can. We saw over the course of just a couple of weeks, we went from no admissions, which was just a breath of fresh air to have, no admissions in the hospital, at least for a few days, up to 27. We're a little lower than that today. And of course, today is not over. But we have seen a significant increase. We've been watching with a great deal of interest what other hospitals in Michigan have been experiencing. And I can tell you on the east side of the state, it went from pretty good shape to a really troublesome picture very quickly. Our friends at Beaumont have, 400 COVID patients in the hospital. And just a week or two ago, that was half that. So I mean, it can explode in terms of inpatient cases quite rapidly. And I certainly agree with everything that Nicki's been saying about the variant and what kind of a role that's playing and what kind of role the immunization is playing. But I can tell you in the Spectrum hospitals, we are like everywhere else, we're seeing a younger cohort being admitted. We have within our facilities, overall, Spectrum Health facilities, we've admitted children. We have folks less than 30 on ventilators in the ICU. We have more in their 40s and 50s than we have before. The average age of our individuals that have been admitted is about 10 years younger than it was just a few weeks ago. And that certainly is related to vaccine successes in the older individuals. And I completely agree with Nicki. We would be in so much worse shape right now if we had not been so diligent in immunizing some of the oldest folks in our population. We just would be inundated right now. But it is just a reminder that when enough people get infected, somebody's going to end up in the hospital, somebody's going to end up in the ICU on a ventilator, and somebody's going to die. And that is occurring in a younger group of people than we were seeing just a month or two ago. So it's reason to be concerned. It's reason to be very diligent in social distancing, masking, hand hygiene. And I would just say, related to the vaccine, God bless you all that have taken the vaccine. Thank you so very much. The life you save might be your own, but it also could be your neighbor's. And so I think that's a responsible thing to do. Across the world now, we have given, more than 500 million doses of a vaccine. We know just about everything there is to know about side effects. Never in human history have we gotten so much vaccine data so quickly. Never in human history have we known the benefits and risks of both a disease and a way to prevent it so quickly. Now, a year may seem long to you, but in the past, we would have to go decades and decades to get this much data. And the serious complications of the vaccine are about serious complications that are typically treatable, are about 2 in a million. And we're still seeing a mortality rate with the folks we admit to our hospitals of around 2%. So that benefit and risk is a really clear calculation, at least in my head, and everybody else that is studying the data. It is much safer to get the vaccine than it is to take the risk of getting the disease.
Thank you both. And with those rise in cases, can you remind everyone of the testing options that we have available, as well as a new testing option available for patients at Lakeland?
Mm-hmm.
Yeah, and I'm glad you're bringing up testing, because one trend that we have noticed is really for the last 3 months or so, the amount of tests being performed in Berrien County has been flat. We really haven't seen a change in demand. It's been an average of about 400 tests per day happening. And we do know there are some fields that have mandatory testing for employees and healthcare workers in really high risk situations like nursing homes, and there's things like that. Usually when we start to see an increase in cases, we see a similar increase in the demand for testing, and we're not seeing that right now. So that's something that's different than what we've experienced previously. But so just really want to encourage folks, if you're feeling symptoms, COVID symptoms, respiratory symptoms, where you've got the cough or the fever or anything like that, we really encourage you to get tested. There's a robust list of places to be tested on the health department's website. That's bchdmi.org/COVID-19. There are a variety of testing centers across the county that we just really encourage you to do that. If you think you've been exposed, or you've been exposed, after a few days after that exposure, go ahead and get tested as well. Testing is one of the really important tools in our toolbox that we can use to break these chains of transmission, because once we know somebody's positive, then we can figure out who might be incubating the virus and use quarantine to help prevent that chain of transmission.
Great.
And Lakeland, let me just add to that story. Thank you, Nicki. You can call your physician and they'll schedule a test. And if you don't have a physician, you can go to the walk-in clinic without an appointment and you can get a test there as well. I would just caution, I am sure none of you on this call have ever done this, but we're hearing these reports. I think I'm sick. I probably don't want to get tested because I really don't want to know. Somebody might quarantine me, or I might have to cancel my trip on spring break to Florida. Please, that is not a responsible way to treat a potential infection. This is still taking lives in our community. And when you give that disease away, somebody else could get it and could die from it. So please take this seriously. And if you have symptoms, you really want to be tested and treat it right and have all the responsible advice about being careful of not infecting others. You know, the only way to make this go away is if we're all doing the right thing every time we think there's an infection and doing the right thing around vaccination.
Yep.
And going off of that, Nicki, can you just remind us of the difference between quarantine and isolation and what is recommended if you've been exposed or have symptoms?
Yeah, so quarantine is a mechanism for keeping somebody who has been exposed, and we don't know if they are infected yet or not, because they were exposed. They may not have been infected, but they might be. So we want to keep them away from others so that if they do end up being infected, that can kind of stop that line of transmission. So quarantine is used for those who are exposed, but unknown if they're infectious at that point. Isolation, on the other hand, takes somebody who is known to be infected. They've had a positive test result, or they've had an exposure and have symptoms and are then considered a probable case. Isolation keeps those individuals away from others while they are infectious to, again, prevent potential transmission of the virus. So we know that people who have had that close contact, they've had close contact with somebody with COVID-19, we want them to quarantine for 10 days. The exception is if this is somebody who you've been exposed to somebody who has a variant strain, they're known to have a variant strain, the quarantine has to be 14 days. And this is per the CDC guidance. If you recall, a few months ago, we took quarantine. It was 14 days for much of 2020. In December, that was reduced down to 10 days based on some evidence. Now that with the variants, that's a 14-day quarantine. We understand quarantine is incredibly uncomfortable and it's inconvenient, and it does upend a lot of things, but it does remain an important tool in our toolbox. And remaining diligent with quarantine and isolation over the next few months while we continue to increase vaccination rates continues to be a really important way that we can reduce the amount of hospitalizations and potential lives lost.
And we know spring break for a lot of people is next week, or they may be considering summer travel. What is the guidance on travel, or what are your recommendations for people who may be considering that?
I think at this point, the CDC is being fairly conservative in not recommending travel, knowing that we are at the start in our state, but also as a country, we're seeing this rise in cases. We don't know where that rise is going to level off, and if it's going to just keep going or if it's going to suddenly plateau, because we've experienced both throughout this pandemic. Travel can increase your risk of getting COVID-19 and spreading it. So if you do travel, it's really important to take precautions. If you're able to be fully vaccinated before your trip, that's certainly helpful. Also, getting a COVID test before your trip, 1 to 3 days before your trip, is helpful. Just because you had a negative test does not mean you're not going to become positive thereafter. That's only related to that one day. But those are some things that you can do to try to prevent spreading the virus while you're traveling. And then you also want to try to reduce your risk of becoming infected. So this is where it becomes incredibly important to still maintain social distance, try to avoid crowds. If you can, I know a lot of people are taking road trips as opposed to flying, feeling that there's more control over their environment. They can be at least in a vehicle only with people from their household. You have a little bit more control along the way. A lot of people are camping, trying to be outdoors. So there are some of these options you can take while traveling to still reduce that risk to yourself and to others. Avoiding destinations that have high population density. There are some states that are allowing really large gatherings. It's not advisable to be around really large groups of people at this point in time. So those would be my recommendations, our health department recommendations for what you could do to reduce your risk.
Great. And let's switch gears a little bit and talk about vaccines. That's still a big topic we're focused on. Can you provide an update on our vaccination efforts here in Berrien County and the progress that we're making?
Yeah, so far we're rapidly approaching 70,000 doses administered in Berrien County, and for having had the dose or the vaccine in our County for only about 3 months. That's a pretty incredible effort. So it's definitely taken a lot of people and a lot of long hours and a lot of partnership to make that happen. But we definitely are getting doses administered. This represents, thousands of doses every week that are going out, again, from the health department, from Spectrum Health Lakeland, and a variety of pharmacy and other partners. So we're really grateful for the team effort and that community-based approach towards getting vaccination out. Of those 66,000 doses that have been administered in Berrien County, that represents 41,000 unique individuals. So we have about a third of our population over the age of 16 that have now received at least one dose of the vaccine and are on their way to being fully vaccinated. So our coverage is continuing to grow, and those are really good signs. Again, that's probably part of the reason why we're not seeing increases amongst our older adults in the number of cases like we're seeing in younger adults. So that's all really positive. Among those who are 65 and older, we have about 70% of that age group that has had at least one dose of the vaccine. So we're really happy with that. We continue to receive more vaccine weekly. The amount of vaccine that's coming to the state of Michigan and then to Berrien County is starting to increase a bit more. And so that means there are more providers coming online to be able to give that vaccine. And there's multiple mass vaccination clinics being held each week. And I know last week there was the clinic that was led by Spectrum and partnership with the health department, where we did over 3,400 doses of vaccine at one time. So lots of efforts underway, lots of impact that's happening as a result of those efforts too.
I would just add maybe two things. One is, if you're one of those individuals who had COVID, are certain you have COVID, and said, well, I'm maybe not going to take my vaccine because I don't think I'm at risk. We are now starting to see folks who had a previous diagnosis with COVID that have gotten sick with a new strain and been admitted to the hospital. So that previous infection is not a guarantee that you have a long-lasting antibody, and not a guarantee you have protection against the B117, the UK variant. So now's the time to get your vaccine. If you've been one of those individuals that just want to let somebody else go first, you say, I'm not as high a risk as somebody else, but I think I'll wait and let somebody else go first. Now is the time to get your vaccine. If you've tried before and the lines were long or the waiting lists were long and it was discouraging, you decide to try later, now's the time to try. We expect very soon that we're going to have more supply, and we're going to be looking for folks to give the vaccine to. The folks that are really anxious to get it lined up and got it early. And now's the time for just everybody to get in line and get the vaccine. Particularly if you are younger and have decided I'm at low risk and I'm going to wait until that vaccine is more available. It's available. Yeah, we've eliminated essentially all of the backlogs. There's a few that still show up, but we're not waiting weeks and weeks and weeks to get people in for a vaccine. There's now vaccine available in many more places, and we're grateful for that. So you have many more choices, but it's time to sign up and schedule your vaccine.
Yeah, absolutely. And I mean, to that point, that's an excellent point, Loren, because we have started to see in some of our clinics, it is taking a lot longer to fill all of the appointment slots. We generally eventually do, but it's taking a lot longer. So if you are sitting there thinking, I'll wait and do my part, no, we want you to get vaccinated now. We've got space for you. Please come.
Great. And I think a lot of people are wondering this term herd immunity, or how much of the population needs to be vaccinated before this thing is over. Could you both touch on what herd immunity means and what we're striving for to get there?
Mm-hmm. Nicki, you want to start?
Sure. So it's hard to say exactly if we get to X percentage, we're at herd immunity, and then it's not like herd immunity is a switch. It's more of a dial. Just as you have more people vaccinated, more people have immunity. There are just fewer people that are susceptible to the virus and infection. So once a population really reaches a point where there's a high percentage of the population that is immune and not susceptible to that infection anymore, that's when you have this herd immunity. The virus still may be out there and it's still going to be transmitted, but not at the levels that you would see otherwise, because there are so many protected people. So some of the estimates are for COVID that we'd have to be anywhere from 50 to 80%. Here in the state of Michigan, the prevailing thoughts and goals are really 70 to 80% of the population. So that's really what we're targeting for. That's what we're shooting for. So our county is, about half of the way there to that 70% goal. Obviously, more than 70% is also okay. And at this point, the vaccines are only available for adults. So when we're talking about these percentages, it doesn't include the 25,000, 30,000 individuals we have under the age of 16 here in Berrien County. So we've still got a ways to go before we get there, but we're making remarkable progress.
Yeah, I would add a comment, and that is, I agree completely. This is a dial, not a switch. And this is under ideal circumstances. My belief, and I think this is born in science, that most of us are going to get an antibody, one way or the other. We're either going to get the antibody from the disease, or we're going to get the antibody from the vaccine. You are going to get the antibody, one way or the other. This virus has no indication that it's going to go away magically when 70% of us get a vaccine. It will just drop to a low enough number that it's a little easier to manage, is not choking our hospitals, is not interfering with travel as much. It's going to be better, no question about that, if we get 70% vaccinated. But one way or the other, most of us on this planet are going to get an antibody, either passively with a vaccine or actively by getting the infection. And there's pretty good evidence for that. If you accept that reality, then I would just say, don't trust. Well, I'm going to be one of those 30%. Everybody else is going to get that vaccine, and I'm going to be protected by their immunity. I think that is not either a responsible way to think about it or an accurate way to think about it. You might not get it right away, but you are going to get it. Second point is, this virus has shown an amazing propensity to mutate within the human body and create a new variant. And those variants can be scary. Those variants can be worse. What you see going on in Brazil right now is tragic, with thousands of people dying every single day. Very aggressive acting variants are likely going to occur in the course of this pandemic. So the race is to get antibodies in as many people as quickly as we can, so this virus has fewer chance to mutate and fewer chance to kill our friends and neighbors. As you know, in this country, we are now up at around 560,000 deaths in a year. That is more lives than we lost in World War I, II, and Vietnam, 10 years worth of battle. That's about the same number of lives, and will be a little more within a week or two than all that conflict. I mean, it's a really big number, and it's going to grow substantially between now and when we win. So I would just give you a little caution on the herd immunity. Herd immunity doesn't occur until everybody really has an antibody, and now there's protection, and you're going to get them one way or the other.
Yep.
Great. And we're closing in on time here. So I think if you can both just remind people how they can get a vaccine. Both Lakeland and the health department are now scheduling for anyone 16 and up. What are the steps that someone can take? How do they get an appointment?
Yeah, at the health department, if you're 65 or older, we are still holding spaces for those that are 65 plus. So if you are 65 plus and not yet vaccinated, you can call our hotline and get immediately scheduled for a clinic. That phone number is 1-800-815-5485. Otherwise, we are posting our links to appointments on our website. Those are definitely updated every Monday and Wednesday, but sometimes more frequently depending on the week. But that's how you can get an appointment with the health department.
Yeah, to Lakeland, if you go to our website, spectrumhealth.org/vaccine, you can self-schedule the appointment. If you call 927-5100, you can schedule that by phone. I'll be a little caution. We're vaccinating people over 16, but between 16 and 18 requires a parent, and so you want to make sure if you're advising your young adults it's time for vaccine, make sure you're at their side as you're scheduling that appointment.
And just as a note on that, only the Pfizer vaccine, as a reminder, only Pfizer has been approved for the 16 and 17-year-olds, whereas Moderna is 18 plus. So right now, the health department is the only, one of the only providers, at least between the two of us. We have Pfizer right now. I don't believe Lakeland does. I think Meyer also has Pfizer. But if you're looking for a vaccination for a 16 or 17-year-old, be sure to ask what products are available. You can only have Pfizer.
Great. Well, that wraps up our questions for today. Any closing thoughts either of you would like to share?
Well, I appreciate you showing up, hopefully one more time to us. And we know that some of you have been with us many times. Thank you for showing up and listening. Please spread this message to those around you. Not everybody gets a chance to hear this. And those folks around you that you influence in a positive way, you could actually save their lives with that conversation or save the lives of somebody near them. So thanks for joining us and thanks for sharing the message.
Yeah, and just, you know, the finish line is in sight. It's a ways down there, but it's in sight. We can see it. Let's not stumble as we're getting to that finish line. So let's just continue to be diligent. We're grateful for all of the times our community has really come together and did what they need to do to stop the surge in cases in Berrien County and flatten that curve. We don't want to be careening towards another situation like we were last November, where we were very concerned about our healthcare capacity. So we're going to buckle down just a little bit longer and make sure we're avoiding our large crowds, that we're maintaining some social distance, wearing our masks, good hand hygiene, staying home if we're sick, honoring our quarantines so that we can break those chains of transmission. So we thank you for being our partners in this so that we can all have the healthiest community we can.
Great, and thank you everyone for tuning in. Again, a reminder, there is information on COVID testing and vaccine appointments available on both of our websites, spectrumhealthlakeland.org/COVID-19 and bchdmi.org/COVID-19. Thank you.